VRE, Vancomycin-resistant enterococci, by Erica Zarilla, Lauren Davis, and Sarah Sammons. What is VRE? VRE is a part of the Enterococcus family. Enterococcus, or Streptococcus, is part of the body's natural flora and is found in the intestinal tract, the skin, and the female urinary system. VRE is a strain of the Enterococcus family that through genetic evolution has become resistant to the antibiotic group vancomycin. VRE is also a gram-positive cocci. VRE is spread in two primary ways. The first is contact. This is why VRE is seen so rampantly in hospitals. This is also why we enforce good hand hygiene practices, because if a nurse comes in contact with a patient who has VRE and does not wash her hands before taking care of her next patient, the next patient is susceptible to getting VRE. The second way VRE is spread is through the overprescription of antibiotics. It is important to not get antibiotics unless your infection is bacterial, because if it is viral, the medication will do nothing. The overuse of antibiotics allows bacteria to become resistant to the medication, and that's what's causing us to be in the crisis we are in today.
Symptoms of VRE may depend on where the infection is. You may have any of the following: fever, chills, and body aches, weakness or dizziness, urinating more often than usual, or pain when you urinate, urine that smells bad or blood in your urine, pain or pressure in your abdomen, red, warm skin around a wound, or soreness, swelling, and drainage from a wound. VRE affects various parts of the body, such as the urinary tract, where you can see symptoms such as frequent and painful urination, fatigue, and lower back pain. It can affect the bloodstream and cause symptoms such as fever, chills, increased heart rate and respirations, vomiting, and diarrhea. VRE can also be found in wounds after surgery or where an indwelling catheter is placed, and signs and symptoms that can present are redness, swelling, and soreness around the site, as well as fluid leaking from the wound. These symptoms appear at various times and depend on where your infection is. The diagnosis of VRE is made by laboratory testing. Blood tests check for VRE and help healthcare providers plan which antibiotics are best for treatment. A sample of your bowel, urine, or wound will check for VRE bacteria. The lab will grow the bacteria and then test to see which antibiotics will kill the bacteria. Some might ask, how soon do these symptoms appear? The period between being infected and developing symptoms is variable and is not well understood. It is differentiated from other diseases by the way it grows in the lab as a gram-positive cocci and because it manifests differently than other antibiotic-resistant diseases.
So how serious is VRE? Well, the bacteria that causes VRE, the enterococci, is not usually a harmful substance. It only becomes harmful when it gets into the urinary tract, the intestines, the bloodstream, or wounds. So it's pretty much an opportunistic pathogen. Once it gets into these places, it causes the very serious signs and symptoms that we talked about earlier. And sometimes patients can have the enterococci bacteria colonize inside their body, and they'll be asymptomatic, meaning they will never show symptoms, and therefore they will not be treated. But if a patient is showing symptoms, they'll be treated depending on those certain symptoms. Usually they're treated with a combination of various beta-lactams and daptomycin because of the resistant properties that VRE has. It is difficult to find an antibiotic that will actually work. So lab tests are usually ordered to see which types of antibiotics are sensitive and which ones are resistive. The only downside to the treatment, like I said before, is that it's difficult to treat because of its resistant properties in causing the antibiotics not to work. It could cause the bacteria to just continue to multiply and cause even more harm to the body. So it's causing more harm than good. Another thing that could happen is that by introducing more and more antibiotics to the body, it could cause a relapse of VRE. What can we do to prevent VRE? Well, to start, make sure that you know the risks and benefits that come along with the antibiotics that could be prescribed to you if in the case you do become ill. Make sure you know that there is a potential risk for your body to form an antibiotic-resistant bacterial infection, such as VRE. A very important method to prevent the spread of any type of bacterial or viral infection is to practice proper hand hygiene. Make sure that you are frequently washing your hands with soap and water for at least 30 seconds, and be sure the water is warm water. Make sure you always wash your hands before touching your mouth, touching any types of food, or touching any other patient. If you're in the hospital, make sure that the hospital staff, your visitors, and anyone that comes in contact with you is adhering to the specific contact precautions, and that they are wearing the proper PPE to prevent the spread of infection between you and your patients. Always be sure that the hospital staff is wiping down surfaces with strong antimicrobial wipes before, during, and after a patient's stay to ensure that all of the bacterial count is destroyed. Now let's talk about some fun facts about VRE. Well, as fun as we can get. VRE was not discovered until the late 1980s. The first outbreak occurred in the UK and soon started spreading to France. Since then, VRE has been linked to farm animals. Scientists have discovered that the antibiotic avoparcin is used to promote health in the animals, and it has a structure much like vancomycin. It has been known to be a promoter of VRE. VRE is more likely to occur in patients that have suppressed immune systems, such as chronic diseases like diabetes and kidney failure. A more disturbing fact about VRE is that 63% of hospital rooms are contaminated with traces of VRE. So always be sure to be aware of the many risks that are around you.